Okay, go.
Okay. Hi, I'm Dr. Cynthia Cornelius. I've been in private practice in podiatry in Connecticut for 19 years, board-certified podiatric physician, and I'd like to explain a phenomenon that I see fairly frequently but doesn't seem to be explainable by a lot of physicians. It's about chronic ankle swelling. I often see patients that even for years, months, or sometimes years, that have one ankle swelling for no reason that they can ascertain. If it's a fairly obvious cause like an ankle sprain, it swells, it goes away, and then we're done. But very often I see long-term one-sided ankle swelling without a clear explanation. And here's what I think is going on. Something you never even think about is our skin is bound down to the underlying structures in different strengths all over our bodies. I think of it kind of like quilting. Some areas of our body have very few stitches per square inch, let's say, and you can pinch up some flesh. It's an area like this is not very tightly bound down to the underlying structure, so there's a potential space there. The tightest areas of our bodies are the palms of our hands and the soles of our feet. They are bound down very tightly to the underlying structures, and there's really no space, so you can't really pinch up space between the skin and the underlying structures. When you get, let's say, an ankle swelling, maybe an ankle sprain, the tissues swell, you've seen swollen ankles, and the swelling itself tears some of those fibrils that bind the skin down to the underlying structures underneath the skin of the ankle. The ankle is sort of neither very tight, neither very loose. It's sort of a medium bound down, quilted down structure. So after 6 weeks or so, your swollen ankle is no longer hurting, the incident is over with, but you still have often those torn fibers that do not stick themselves down, so to speak. So what happens then is you have a potential space there. So when we get excess fluid, for any number of reasons in our body, we get excess fluid, and gravity itself will pull the excess fluid down to the ankles, and in the ankle that has a potential space, i.e. the skin is not tightly bound down to the underlying structures, it swells, it collects in the potential space, and now an actual space, between the underlying structures and the skin, and you get this doughy ankle swelling. Doesn't hurt, doesn't do anything. Often you don't wake up with it in the morning, but that explains how you can get chronic ankle swelling way past an injury that you've even forgotten about 27 years ago. How do we treat it? Well, it's not that easy to treat, frankly. But I think it often helps just to have an explanation for why you would get this particular phenomenon. I thank you for your time and trouble.